Hello and welcome to Chairside Live. I'm your host Megan Strong, and we've got something a little different than what you normally see here on Chairside Live. Our dental assistant Will Schmidt is taking us across the globe to Fiji, where he performed charity dentistry for hundreds of patients in just 10 days. Glidewell Dental was thrilled to support Will on this trip by donating supplies, and I can't wait, so let's check it out.
You know, so many of our Chairside Live videos brings you tips, tricks, and techniques. Today I think I'm going to break from the norm and share a feel-good story that shares my involvement with Glidewell Dental, my love for dental charity, and my love for the ocean. In the rare instances when I can combine these three factors, it's a recipe for success. I was recently able to link up with the Fiji Dental Medical Foundation for their 6th annual trip to the island of Malolo to provide charity dentistry for the island's residents.
My name is Greg Hurd, and I'm the founder and president of the Fiji Dental Medical Foundation.
My name is Dr. Greg Mogling. I'm a board member on Fiji Dental and Medical Foundation. We do volunteer dentistry down in Fiji in a remote section of the islands called the Mamanutha Islands, and we go down and provide free dentistry for the villagers.
When Dr. Hurd and I first spoke, he was really excited to talk to me. I think the first thing he said to me was, a surfing dental assistant, we have to have you come with us.
I've been going to Fiji since '92, and over the years in '97 we found Namotu Island, and we would go back once a year, sometimes twice a year, to fish and dive and surf and have a good time. And we became friends with the owner of the island, and in addition to that, we became friends with the staff who were Fijian. And every time I go back, there would be the Fijians smiling and missing a tooth, and I go back the next year, they'd be missing another tooth. And I really started finding a cause here to help out, knowing that the healthcare there is not very good, and the dentistry hardly anything at all.
And that was the start of the foundation. He got this idea that he wanted to give back to the people. I was introduced, we met, and the rest is just history. It just felt like such a natural thing. I wanted to return to Fiji. My first experience down there was just amazing. And the chance to go back and do something that I love to do, dentistry down there, was just kind of a natural fit.
One thing Dr. Hurd asked for me not to get frustrated with was the amount of technology they simply didn't have. I mean, they didn't have x-rays, their chairs were from Costco and mounted on cinder blocks, and there's absolutely no advanced sterilization techniques.
We work under the Minister of Health in Fiji, and it's the Wellness of Fiji program. All our services that we do, all the treatment that's rendered, has to be recorded and presented to the Minister of Health.
They give us the community center to work in. It's about an 800 square foot building. We, 4 of us go down a week early. We build the clinic. We start from an empty room, and within a day and a half we have 6 chairs, sterilization room. We have everything dialed in and ready to go.
Right now, since we've been there 6 years, and the Fijian people are realizing what time of year we're there, there's a relation now, and they know when to come. But when we first started, we would send out emails and try to get notices to the people, and they had no clue until we started setting up what was going on. Well, by the second day, through the Coconut Telegraph, these people were lining up, 50 deep.
So we've tied in with some the medical side, and we screen for blood pressure, diabetes, we do hemoglobin counts, and so we've been able to tie that in with our dentistry, and through education, I think we're making a difference in the villagers.
When we're screening all these patients, there's a lot of different factors going on. We want to do the most we can for these patients, but we want to see as many people as we can too.
So when our volunteers come down, we hit the ground running.
We had 2 pediatric dentists, we had 2 GPs, actually 4 GPs because Dr. Mowgli and myself are GPs, and we had 2 oral surgeons. So that's a total of 8. I have to screen these patients, and we try to target pain and infection first. And then we will target any type of dental caries. In addition to that, if there are extractions and they're in the anterior, we try to provide flippers for them.
The majority of the villagers work in the resort hospitality industry. There's a number of resorts spread throughout the island, and they work in there. And if they're missing a front tooth, you can see that they're embarrassed by that, and they don't smile. They have to be in front of the public. And when we started adding partial dentures to what we do down there, it became the hit. I mean, we have people every year coming up and they want false. Can we have false? And that's what they call, replacing their front teeth.
And that's something that's very rewarding, and it's got to be thought out prior because we have to have at least a day to turn this around.
Gladwell Dental was willing and able to donate a number of things, ranging from dental supplies and, of course, our Camouflage nanohybrid composite.
Thank you. I mean, that was just such a wonderful thing. We beg, borrow, and steal for a lot of our supplies. It's as a small foundation, we run on a shoestring budget, and Glidewell did donate a number of things, some Camouflage composite. And the feedback I got from our general dentists working with it is they were just so happy. Again, because we've had some in the past, it's difficult to work with. And this one was, that material just seemed to really work well in the conditions we were working under.
90-90, we say. 90 degrees, 90% humidity. It is hot. We do have fans blowing. I think we have about 25 fans that we run with generators to try to cool the clinic down, but you are constantly sweating.
Where most composites couldn't hold up, Glidewell's Camouflage composite held up against the elements. I remember this one woman in particular. She was missing most of her central incisors, and we used Camouflage to reconstruct these with Chairside veneers. She hadn't seen herself like this for years, and just her look and her reaction in the mirror was priceless.
When you get to meet these people and you see how you change their lives, especially when you take out teeth that are not healthy and they're embarrassed, and you give them an upper partial denture and they're able to smile and feel socially acceptable and have confidence and go back to work, that's rewarding. That's something there that just keeps you coming back.
So there was an older man. We'd just taken 5 teeth out of his mouth, and I'm trying to take him over to check out, and he runs out of the clinic. And I'm looking to see where he's going, and he grabbed a stick outside, and he was hitting mangoes out of a tree. And he runs back to us, just gauze stuffed in his mouth, and his arms full of mangoes, and he says to us, "This is all I have to give."
And it's amazing. You see somebody walk in and they're covering their mouth and they're shy and they're a little embarrassed, and we pop in a partial denture and they look in the mirror and the smile grows, and they're just so happy, and you've changed their life, and that again is, it's why we go back. It makes it fun.
Ultimate goal, once I retire, I'd like to do this full time. It's something that I could see even some of the board members segueing and doing.
But the volunteers that come down, they pay their own way. They give of their time. Most of them, the dentists and oral surgeons, take a week out of their practice to come down. The other volunteers are all missing work. They come down, pay their own way to be there. They give their heart to the people, the Fijian people.
This foundation hasn't set out to change the world. They have very humble goals and ambitions, but they will continue to make a difference in their small corner of the Fijian Islands.
For more information, visit us at fijidentalmedical.org.
My name is Will Schmidt, Registered Dental Assistant at Gladwell Dental and proud volunteer of the Fiji Dental Medical Foundation. Thank you so much for watching, or as we would say in Fiji, Venaka Vakalevu.
Wow, that was amazing. Thank you so much for sharing that with us, Will. Well, that about wraps it up for this episode of Chairside Live. On behalf of everyone here at Glidewell Dental, we thank you for watching, and I'll meet you right back here next time.